Hello. I'm going to do some women's health PT videos because I miss doing my job, and I know people have questions and can't get anywhere. Places aren't doing physical therapy telehealth yet, which is kind of sad. And there are a lot of resources online that people can check out. Ask me for them and I'll send you some. So we're going to talk about Diastasis Recti today, which is a common postpartum complaint. It's also called a lot of like silly names, fun, mama pooch and mummy tummy. And there's a lot of systems out there. Some of them are great, and lots of YouTube people making money on some exercise programs. And I think that can be great for people who really can't get out for multiple reasons, and obviously quarantine is one. So I'm showing you in my jammies, quarantine jammies, a couple of things about diastasis. So first, I think it's good to talk about what it is. So diastasis recti clinically is if you lie on your back and you go to lift your head up and you look down at your stomach, and there's a 2-finger or more separation between your abdominals, meaning you sink in and you can feel that there's a line here. That's a diastasis recti. For some people, they get a cavern. When they lift up their head, their belly caverns in. And for some people, they get a dome and a bulge. So all of that is basically just saying that your abdominals are out of sync. It's not usually a surgical concern, although I don't have gross numbers on that because it's 9 o'clock and it's a quarantine video. The biggest risk is that you get into a pattern of your abdominals always working dysfunctionally, and it doesn't put good pressure on your core, and it can really lead to low back pain, hip pain, pelvic pain. And we want your core to be working together for a lot of reasons, the main one being stability. So let's talk about your core a little bit. So your core is any muscle that is between your ribs and your pelvis. So the reason why diastasis happens in pregnancy, other than pregnancy, weight gain, and growing tiny human, is the posture that you're in, and it's prolonged and it's hard to hold. And typically people that have some things that would lend themselves towards diastasis pre-pregnancy, certain postures or exercise habits, might also have trouble afterward. We also know that if you push doing core exercises too far into pregnancy, you're at risk. So you're going to learn a little bit about that. So first, pregnancy posture. Okay, so pregnancy posture is typically, right, the belly's growing and the back gets tighter and tighter and tighter. So now you're pregnant, right? This is my quarantine food baby. It's very nice that it could help me with this demonstration. So here's your ribs, okay? So all of your abdominals attached to your ribs. You have 4 sets of main abdominals. So you have your transverse abdominus, which is your deep core layer. It's like a seat belt in the front of your core. That's the one that we need to show up. That's the one that holds the discs in our back apart. It gives us stability through most of our movement. It also works with our diaphragm and our pelvic floor so we don't pee our pants. We like that one. And then you have your obliques. So your external obliques kind of start at the ribs and then come down and they pull to that center line, and your internal obliques start from below and pull up to the center line. So internal obliques pull down, external obliques pull down, internal obliques pull up. Okay, so those are the important core muscles, but the ones people think are important are your rectus abdominis. So your rectus abdominis is the one that's in a dysfunctional pattern with diastasis recti. So here to here, right? That's it. It's your 6-pack muscle, and it looks nice, but guess what? It only really looks nice if it's held in and together, and it's your obliques and your transverse abdominis that do that. So your main goal postpartum should be turning on your transverse abdominis and your obliques again. And they can be boring exercises, I'm sorry. But when you learn how to load your core again correctly, it can go really well for you. So what you need to do first is think about your pregnancy posture. So what I would recommend is find a loved one. It could be kids. Kids are great at taking pictures, and they can be super embarrassing. And if you just kind of get in what you think is your great posture, and you don't have to be kneeling like this, but standing is actually helpful. And then you have a kid take a picture of you. I want you to really look at the relationship of your ribs to your pelvis. So a lot of us are told to pull our head up towards the sky. Now, I'm pretty flexible, okay, like a little too flexible. So if I do that, I go too far. Whoop, there's my super straight posture. Other things that people say about posture is head up, shoulders back, okay? We are not made to be this way. Look at my stomach. Like, hello, quarantine food baby, okay? We don't need that. So we've got to get the ribs down. Ooh, look at that. Different posture. And if you look at me from the side, I'm still pretty straight. But in my mind, because I've had years of conditioning of people telling me to sit up straight, and that with that thought comes rigidity. I don't want to be rigid, but that's what happens, is you go like this, right? So you're like, oh, I'm really straight, but everything's pointing the wrong way. And the other point here is that makes your low back very tight, right? So again, very tight low back, very overstretched core. All right, so you can kind of use this principle then to do any exercise that's upright. So as long as you keep your ribs over your pelvis, so your pelvis is the other part of this. So pregnancy pelvis, right, is dumped in the front. So there again, there's that curvy low back, quarantine food baby. All right, so then you're just gonna connect your pubic bone to your ribs, and then you're straight. So that is going to help activate your glutes a little bit. It's going to help. You notice I exhaled. So if I inhale, stretch out, exhale. That's another exercise you can do. When I exhaled, this hand came in last. And so that's a problem that people have with their breathing. They let this hand come in first, so that looks like this. See what happened? Woo! That's a diastasis waiting to happen. So you want to be thinking about that transverse muscle coming in the front and then connecting from bottom to the top, because that's the way we disconnected, is bottom to the top. So we want to reconnect bottom to the top. So if you're lifting arm weights, you're loading your core. If you're lifting your kids, you're loading your core. If you're breathing, you're probably loading your core. So what I want you to think about is just in daily life, you can actually help reverse a diastasis by not gripping these muscles down. You can focus on staying rested here so that you can get your breath moving in your body like this. And from the bottom up. So all of that actually helps load and turn on your deep core. If you do that with something in your hand, then you put a tensile load on your tissue. That's how muscle strengthening works, tensile loading. And so we want to do that from an optimal length position. So this is too long while this is optimal, right? So we want the distance between the ribs and the hips to be optimal. So there's a lot that can get sort of funky with that, like tension in certain other joints, weirdly the ankle, sometimes the mid-back can limit where you put your ribs, the ankle can limit where you put your hips, and therefore your pelvis. So that's why I would recommend going to a PT if any of them were open. Okay, so then lying down exercises is the last thing I'm going to cover. So lying down exercises are really popular core strengthening exercises that will get you into a lot of trouble because it's really hard for your deep core to turn on in these, and those pregnancy muscles are going to want to kick in. All right, so what's the pregnancy muscle? The pregnancy muscle are the ones that do this to you, right? So if you see that happening or feel that happening lying down, you're going to be hurting your core and your diastasis will grow further apart, right? So if I do this with my spine, my core grows further apart, and that's basically the definition of the diastasis. So if I lie down, and I'm stealing this from Katie Bowman, she wrote a book called Diastasis Recti. She has a website called Nutritious Movement, and this is just brilliant because it's just corrective exercise. So if I lie down with a stack of some random blankets I literally have lying around, I want to line up my ribs with my pelvis. Okay, so if I'm lying here, I should be feeling like my ribs are down. So what I've done is I've bolstered underneath my head and my shoulders, okay? So now if I do a chin tuck and a head lift, this should be able to stay down and in, right? Quarantine food baby, not so bad, okay? So then any leg exercise that you do from here, you make the load as small as you can to start, and then you increase it with time. So one of the most famous ones, right, is just the dead bug. So if we break the dead bug down, you lift one knee up, you're connected. Oop, I'm not connected, so I'm connecting, right? I'm saying connecting my pubic bone to my rib cage, lift my other leg, lift my hands up. So now my spine and my core is having to hold up both my legs, my head, and my arms. If you have a bad diastasis, you can't do this, okay? So that might mean you just practice one leg lifting and lowering while holding your core, right? This is a partial dead bug. And yes, it's boring, I'm sorry. And then you might do just the arms, right? Maybe the arms are actually harder for you because you've never considered your arms as part of your core, but you need a good core to lift stuff, you do. So from here, you can get into more complicated exercises. And so I've been talking too long, so I'm going to reconnect. Okay, and then you straighten your leg out, but I don't want to see that pregnancy posture come in. So if I go too low and I'm not connected, there's that pregnancy posture. This muscle is no longer engaged. So now I'm loading myself in a way that encourages this to come apart, okay? So if you're doing any exercise routine and you can just catch yourself, like if you do both legs up, as soon as you lose control, I'm going to lose control on purpose. So right there, right? Woo, there went my ribs and my whole body went. So that means I can't go that low. So I might just start with double leg lowers that I can control. And then over time, what's going to happen is I'm going to work on my breathing. I'm going to work on my pelvis staying really connected to my ribs. And then I'm going to be able to go lower, maybe I'll be able to go faster, maybe I'll be able to add a medicine ball or some weights. That was a lot of really fast talking. Whew. Okay, other things to talk about is planking. So planking by any other name, right, is literally just holding a flat position of rib cage to pelvis. It shouldn't be hard, but if you don't know what neutral is, you're probably doing it wrong. So if you plank, okay, and you're in pregnancy position, right? Oh, I can't even do it. If you plank and you're in pregnancy position, it's going to cause problems for you, okay? So if you get really low and you're connected, you should be okay. But if you lose that connection and kind of hang into your shoulders, you're going to hurt your diastasis. So you have to find ways to video yourself and watch yourself for control. You can also touch your stomach. If you can feel your diastasis is really prominent, don't do it. I also tell my patients that if your belly is bulging, right, if it pops out when you load, it's too much for you. So you need to change something about the exercise that's bulging you to make it less. So bolstering is a great way to think about that. Think about how you can decrease the range of motion that you're moving through, like maybe not go all the way back, maybe do half, do lighter weights. So the more that you use this better diastasis position, the smarter your core is going to be. And I think that's the big thing. It's something that you have to practice all the time. So if you do 15 to 45 minutes of exercise every day, but then you flip into pregnancy posture for the rest of your day, you're not going to heal your core. And when you're lifting your laundry basket and picking your kids up and changing diapers and your belly's just hanging out and you're in that pregnancy posture, you're just making the situation worse. So really thinking about it, start to think about rib cage, pelvis, are they connected in the front, or am I just holding my back really tight and go from there. Ask me other questions if that doesn't work.